This is episode 9 of the Shared Practices podcast. Not going to have a big long intro or outro right now. I'm just going to go straight into the interview. So this is an interview with Dr. Tarun Agarwal. Most people know him as T-Bone from T-Bone Speaks, his podcast, T-Bone Sleeps, which is his sleep apnea course. And all of this falls under the umbrella of 3ddentist.com. That's actually 3d-dentist.com. And he also does CEREC training, a whole lot of hands-on courses. Phenomenal educator. Very, very grateful to have him on the show. So without further ado, Dr. Tarun Agarwal. So we've got here Tarun Agarwal from T-Bone Speaks podcast. A lot of people know him from Alan Mead's podcast, Dental Hacks. Someone who's not very opinionated. That's how I would describe you, is not opinionated.
Right. I have no opinions whatsoever.
No opinions. And there's some things that you've said on Alan's podcast, on your podcast, that have really resonated with me in terms of expanding the scope of your practice, moving towards practice ownership, and also treating your practice like a business. And I think this generation, my generation of recently graduated dentists, about to graduate dentists, with the debt loads that we have, with the pressures from insurances and corporate dentistry, we can't really afford to just throw a shingle out there and see what happens wherever we want to go. And we kind of have to think about this a little bit more intelligently and purposefully. And so I wanted to talk to you about a few of those things. And the first one was this idea of expanding the scope of your practice. And you've talked about, and you're teaching courses on sleep apnea and CEREC and other procedures. I want to get into the how. Like how does someone move into a new procedure that they're slow at, that maybe they would have to get some equipment, or they would have to invest in some systems and marketing for patients, especially as a new grad who's an associate and you don't have a lot of control over that. One of my friends I was talking with today, he's like, I'd love to learn molar endo, but it takes me 3 to 4 hours, and the practice I'm working at doesn't have a microscope. They've got a few things, but if I could do 3 to 4 hours of operative and crowns, how can I justify, struggling on a molar endo for that same amount of time? So what are your thoughts on the actual how of expanding the scope of your practice?
Well, I think the first step is you've got to define what you're after. And I think that is probably the biggest mistake, one of the biggest, not the biggest. I made lots of the biggest mistakes, but one of the bigger mistakes I've made over the years is I haven't well defined what it is that I'm after. So once you define what it is that you're after, and listen, I boil everything down into one of 3 things. You're either after more money, you're after more time, mm-hmm. or you're after more professional satisfaction.
Okay.
And sometimes you can be after all 3, but generally speaking, there's always one thing of those 3 that you're after. And to give people an example, right now in my life, I'm after more time than anything else. And then maybe in your particular stage or your audience's stage, they're probably after more money than anything else at this point in their life, right? So I would say that that's your driving factor, and there's absolutely nothing wrong with having that as your driving factor. So then I would say, okay, so I need to look at what gives me my most bang for the buck. I may not love doing it as much as I need to love doing it, but it needs to fill a specific need of what I'm after right now. Okay. So then I would look at, to me, I would look at what fits within my, I say life, and right now what I mean by that is your practice life. So if you're an associate somewhere, and you have limitations, to me, I would look at what fits within what the practice has. So that
Sure.
would be, I need to get more efficient at root canals, more molar endo specifically. I don't believe you have to have a microscope to do it. Certainly it helps. I have a microscope, but that's not an option for most associates. I would say, how can I get better at surgical extraction? How can I get better at bone grafting, socket preservation after extraction? extractions? How can I add maybe nice removable therapy to that practice? And so I look at these things as things that are technically already within that practice. As an associate, you don't have to try to sell your doc or your DSO or whatever you work with. You don't have to try to sell them on, hey, we need this equipment because I'm the associate and I'm going to make it work. And then when I leave, you're going to be left with this equipment that you don't know what the hell to do with.
Sure.
So I look at that situation. Now, for somebody, let's say, that's just opened their practice or just acquired a practice, now certainly those things are helpful if the practice wasn't already doing that.
Right.
But I would say the person opening a practice needs to have those skills I just mentioned before you really, truly, in today's day and age, open that practice. And to me, that's one of the goals of an associateship is A, to make money and sustain yourself, and B, to grow yourself in those, what I call fundamental things along the way. So now that practice that person that's acquired a practice, I would look at that situation and say, all right, what is missing from this practice that I can do? And my mind starts jumping to Invisalign, 6-month smiles, Powerproc 6-month
Right.
braces, inman alignment, orthodontic movement. Then I start looking at things like tissue grafting,
Okay.
maybe impacted wisdom teeth. I start looking at things like sleep apnea, the treatment of sleep apnea for your patients. I start looking at things like medical billing to raise your fee level through medical insurance. So those are the things I look at there, because now when you're in control, you can make that decision to make the investments in technology, training, or team members that you need to be able to make some of those things happen. But when you're in an associateship, you don't necessarily have that type of control. So I would look at things that I would look at where am I in control of my own destiny in that situation. Does that
Right.
kind of
Well,
make sense?
oh, absolutely. And going back to what you said at the first part of that was ideally first you'd want to know where you want to go with this, and if you're looking at the time, money, or professional satisfaction, say you want to expand the scope of your practice over here. Say that you want to move surgically towards, implants and grafting and ridge preservation. Ideally, you'd know that before you found your associateship. And
But you
potential.
don't know that always.
That's true.
Like,
But
look, the reason I say that is when I came out of dental school, I only wanted to do restorative dentistry. I wanted to be a cosmetic dentist. I didn't take out teeth. I didn't do root canals. I didn't do implants. For God's sakes, if I didn't take out teeth, I didn't do implants.
right.
I didn't do removable. I didn't do any of that stuff. And I would say that stuff now makes up the bulk of what I do.
Okay. So at some point, how'd you decide what to move on to next? I mean, was it just kind of shiny object? Let's do this one, or did you have a plan, or was it, what, someone was saying this sounds good, let's go for it?
No. I never. I'm not a planner. I mean, I'm a feel, and how did I decide? I mean, ultimately, part of me is the ADD. I've every 3 to 5 years I've got to have something new. I mean, bottom line,
Right.
okay. And I have a rule. It's my rule is different now, but my first 10 years of practice, every year I needed to add a new service to my practice.
Okay.
Okay. So, and again, I started with the very fundamentals. In the beginning, you can do fillings and crowns, and that's what you're good at, right?
Right.
And then I said, okay, I need to add root canals. So we start with anteriors. Then the next year, maybe it's molar root canals. Then the next year, it's okay, I need to learn how to take out teeth. Maybe I need to learn how to do surgical extractions. Maybe I need to do socket preservation. Then I want to add Invisalign. Well, now Invisalign doesn't always work in some cases. Maybe I need something a little bit more cost effective. Now I want to do straight wire orthodontics. I mean, that's 10 years right there.
Right. Well,
So
and it sounds like you gave yourself enough time to get the education, get in there, do some cases, realize what else you need to learn, get some mentorship, go back and try it again. And
But did I really give myself enough time, or was time a product of not having enough money to spend on all of that training? Because, my dad told me something very important to me When I was my first couple of years out of school, I was taking CE left and right, and I don't think people of your generation, your age group, I don't know your physical age, but your age out of dental school,
Sure.
spend enough time taking CE. And I understand the financial pressures, but I call BS on a lot of that. I say learn to live like a college student for another year, but
Right.
I would say that my dad told me, he says, you can learn all the clinical skills in the world, but that knowledge is no good to you until you get a patient to say yes.
Okay.
So to me, I try to start very practical, and and listen, today I can talk about so many advanced things, but ultimately, if our audience is that person that's 1 to 5 years out of school, honestly, that person, in my opinion, isn't ready for sleep apnea in their practice necessarily. Okay,
Right.
because that person can't get a patient to accept quadrant dentistry. They don't have
Right.
that verbal skill or that ability to have that conversation. So how in the world are you going to talk to your patient about the physiology of sleep and all of these things? There's so much that goes into that decision process, or went into that decision process for me. And maybe it was just dumb luck or stupidity that got me at that point in my life. But ultimately, the driving premise was every year I needed a new service to my practice, and every 5 years I needed to reinvent myself in some way, and I call that moving forward. Okay,
Right.
so my moving forward right now is, and this is going to sound absolutely odd to many of your listeners, is 2017. I will not do any more fillings in my practice.
Okay. So you're basically saying there are better things you can do with your time and resources than basic operative, and bring in
Well,
an associate, or what's the plan?
yeah, and we have an associate partner in the practice. And at the end of the day, I look at it this way: insurance is a fact of life.
Okay.
Okay, so why should I get paid the same as you?
Right. I mean, you've got way more experience than I do.
I'm faster than you. I'm more efficient than you.
Totally.
You
Better
know, I
experience for the patient overall.
Yeah. So why should I get paid the same as you?
You shouldn't.
Right, but I do.
Right.
So I look at it this way: is it's not there's no other profession, in generally speaking, in life. If you're no other professional, like if you're a lawyer, do you bill out the same rate the rest of your life?
No, yeah, you increase as your reputation and your cases, justify.
Right, but the difference in dentistry, especially insurance-driven dentistry, is those fees are set by a third party, and they've commoditized our procedures, correct?
Right.
So what I look at is, how do I gain more dollars per procedure? And that simply means I have to give up fillings and move to crowns. Or then I have to give up crowns and move to something to implant. Then I have to give up implants and move to sleep or something else. So ultimately, fillings are a rate limiting factor. You can only charge so much, and at some point, you can only be so efficient at fillings.
Right. Even if you're doing
So,
everything you can to increase your efficiency, it always caps out somewhere.
or I mean, how many damn patients can you see? And
Right.
ultimately, it's even beyond that. Let's say, oh God, I become the fastest filling person in the world. Like there is no one faster than me. I can
Right.
do an MOD every 8 minutes.
Ugh.
Okay, let's just pretend that. Okay.
Okay. It's
So to
awful.
be able to, okay, so now I'm that fast. Me, the one superhuman being, is that fast. For me to be able to see a patient every 8 minutes, I have to have more operatories, I have to have more
Right.
team members, I have to have more everything else,
Hygienist, everything.
everything. So I exponentially increase my overhead. So even though I'm more efficient in producing more, the difference in that production doesn't all translate to the bottom line, because there is a significant increase in overhead. It's not just the cost of the composite carpule. It's the support structure and team that you need, and not even just the team member. It's the physical
The
space
facility. Yeah.
that you need.
No,
That you need.
absolutely.
So
So, no, and that makes, when you say it like that, it's obvious that there's a certain saturation point where you're like, okay, you have to move on from here if you want to go up.
if
Um,
you want to make more money,
if you want to make more money, and
or
that's
you
not
want
for
more
everyone.
time.
Totally.
But
Uh,
because let's say I'm making enough money. I'm going to use the fake numbers here, okay? Let's say I make 100 grand and I'm super happy. Like, and I'm at a stage where I'm financially free, I'm debt free or whatever, and I just need to make 100 grand because that's all I want to make. Now, do I want to work 2 days a week to make 100 grand, or do I want to work 4 days a week to make 100 grand?
2 days.
Right, of course. Right. So to me, ultimately, at some point, and again, at some point, you will get past the money part of this, and the driving factor will be time.
Right.
And then at some point, you'll get to the point where you're working, like you'll be like me and you're working 3 days a week, okay, in the practice. And now it's not about time because I can't work any less than that because I'll go insane.
Right.
Okay. So now it's about how much professional satisfaction can I have?
Okay.
Now it's about, hey, I don't want to be doing the type of dentistry that makes me happy and my patients are happy to see me.
Absolutely.
So it's a natural progression, and see, my mission right now is to get people to understand that there's a natural progression. It can't be how many things can I throw on the wall and find something that sticks. It's got to be, right now my goal is to make money, to feed my family, to support my life, to pay down my debt, and all of those things, right?
Right.
So I got to do things that make that happen.
So I want to go back to something you were talking about a little earlier, that I have a friend that has done what you say that most of my generation doesn't do, which is he has taken so much CE in this last year and is expanding the scope of his practice in a lot of ways. But he's realized that his limiting factor is that case acceptance.
Yeah, and it's the communication.
And it's funny because I almost feel like you have to try some new procedure and then bring it home and try and convince some of your patients to go along with this and fail for you to really have a motivation to go out and increase the case acceptance via courses or coaching or training. Because if you tell a new grad, no, don't go learn implants, go learn case acceptance, they're going to kind of like, but I want to learn implants.
Yeah, but you know what? They're absolutely wrong. They need to go learn case acceptance.
Right. But ironically, sometimes it takes the failing at it and realizing, oh, I'm not that good at case acceptance, for then people to realize, okay, I got to go work on this. And do you feel like there are good resources and courses on case acceptance as well? Like, what would you recommend if someone wanted to go improve their case acceptance skills?
Okay, great. So I'm glad you brought this up. So I recently did a Ask T-Bone, which is one of those, short answer, question answer deals that I have my podcast about the 5 CEs that I recommend. And number one on my list was communication and leadership. And it was also the number one thing that people don't take enough of or any of.
Right.
Okay, so this goes back to my dad's story about you can learn all the skills, but until you get somebody to say yes. So for me, a lot of this really boils down to your personality and your ability to be authentic with your patients. Okay. And I use the word authentic very purposefully because, I am who I am. My personality is I'm a bit, I don't want to use the word abrasive, but I'm a bit frank with people.
Sure.
And I'm that way with my patients. And so it wasn't until I became authentic in my practice that my case acceptance didn't go up. So I can go learn all the great sayings.
Didn't go up or did go up?
And once I became authentic, that's when it started going up.
Okay.
Because I can learn all the scripts, but scripts only give you a framework. And when somebody doesn't answer the script the way you were taught, that's when suddenly you become something you're not. And so I would say the first thing you have to do is there's no right or wrong way of case acceptance. Case acceptance is a matter of a connection with the patient. And to me, you connect with the patient by simply being authentic. If you are abrasive, then you will attract people that are abrasive, that like abrasiveness.
Right.
If you are sweet and meek, you will attract people who like sweet and meek people. So if you were sweet and meek, I would never buy anything from you because you would drive me crazy because you would never help me make a decision and you would talk me to death.
I love Q Optics loops to the point where I reached out to them and asked them if they wanted to sponsor season 1 of my podcast. The first time I put on their loops, I thought to myself, why can't everyone do this? Why can't everyone nail my angle of declination that I want? And the only reservation I had about Q Optics was that their magnification couldn't go high enough for what I wanted. Well, I am proud to announce that Q Optics, as of this summer, August 2016, now offers an expanded line of their prismatic loops. So you can go all the way from 2.5 to 3 to 3.5, 4, all the way up to 4.5 in their same frame that everyone loves. This is awesome because every other loops company that I've used in the past has always said, oh, well, yeah, we can do 4 or 4.5, but not in that frame. We have to go up to this other frame that isn't as ergonomic, and we can't push the angle of declination. And after 3 weeks of using it, my neck's hurting. I'm like, what's the point of using loops if my neck hurts? And I love more magnification. I love being able to see that big cartoon tooth at 4.5x and just know that my margin is money because I can feel and see it. Oh, and did I mention they're through the lens? This is no flip down, flip up, whatever you want to call it. These bad boys aren't going anywhere. If you want to take a look at how they look and the quality of the build, just check out the cover of this podcast. I'm wearing them in the cover of this podcast. That's how much I love these loops. If you are ready to upgrade both your magnification and your ergonomics, you can email sales@q-optics.com with the promo code SP16 for $100 off of the loops alone or $300 off a loop and light combo for our podcast listeners only. That's SP, as in shared practices 16, to sales@qoptics.com.
Because you would drive me crazy, because you would never help me make a decision, and you would talk me to death.
And it sounds like you're kind of similar, and that's how patients are. They want to know that, okay, we're on the same page, whether that's sweet and meek or whether that's authentic or abrasive or whatever you want to call it.
Yeah, I mean, at the end of the day, you got to be yourself, okay? Now, in terms of answering the question about what I would recommend, I believe that case acceptance is communication and leadership, okay? And leadership to me isn't about how you necessarily lead people. Leadership to me is about how you communicate with team members and patients. And to me, there's no one better at teaching that than Paul Homoly.
Okay.
And that's paulhomoly.com. He has a great book. I want to say the book's like $30. It's called "Isn't It Great When Patients Say Yes?"
Okay.
He sells a audio recording of that. That's like, it's an MP3 download. It's like $10 or $15. And so ultimately, even at this stage, I've had that stuff for 10 to 12 years of my career now.
Right.
Okay. I listen to it every quarter.
Oh, nice. Wow.
So every quarter I re-listen to it, and every year I reread the book.
So this is like your case acceptance Bible.
Well, it's not case acceptance, okay? It is, but it isn't, okay? It's about communication. It's about making that connection with the patient, okay? So it's like this. I already know this about you, okay? You're just out of school. You talk about debt, whether you're in debt or not, but you talk about debt. So my assumption is that you're in debt,
Sure.
okay?
Correct.
And so if I come to you talking to you about how cone beam is the greatest thing ever, what's the likelihood that you're going to listen to me?
I'm gonna listen because I like implants, but I'm also gonna think, oh, someday when I have my own practice and money.
Right. So that's about fit, right? That's about listening to your person that's in front of you, okay? In this case, you, and understanding what's in their life right now and what's going on. And so I'm not going to talk to you about cone beam. I'm going to talk to you about things that don't cost money to get started.
Okay.
Okay. And that to me is my patient. Okay. And that to me is leadership and communication. That's also understanding I can't tell somebody, if I say, do you realize you have gum disease? And they say no, I can't just go straight to saying you need scaling and root planing.
Right.
Okay. I have to realize, is that patient aware of their condition or not? And if they're aware or unaware, the conversation I have or the direction I take it is going to be very different for someone who's aware and who cares about it versus someone who's aware and doesn't care about it versus someone who's absolutely unaware of it.
Right. No.
Okay. Okay.
No, that's perfect. And I think I'm still working on the idea of helping patients to own their problem and the co-diagnosis, and that's something I'm not great at yet, and something I'm working on, and that's
How
kind
are
of
you doing it?
um
Are you
I
taking photographs?
I have my camera. I am not
Oh,
taking
that's not
enough
the answer I
photos.
wanted.
No, I'm not
Okay.
taking enough photographs.
But this is why, this is where people say I'm opinionated and I'm an ass, by the way.
No,
Okay.
this is good.
Okay. So this comes back. My whole career, okay, my whole career in the practice and my dentistry outside of the practice was built on one thing, and that was my digital camera.
Okay.
Okay. So my rule, my principal rule is I personally am this is back to being authentic.
Right.
I am skeptic by nature myself.
Right.
Okay. So to me, if I tell you you have a crack in a tooth, that's you telling me this.
Okay.
Okay. Now, if I show you this, now it's not me. Now it's not me telling you. It's showing you proof, right?
Right.
So the proof is in the pudding, correct?
Absolutely.
So to me, I to this day, I do not recommend any level of treatment without a photograph to back up what I'm saying.
And do you prefer DSLR or intraoral, or does it not matter as long as they can see it?
Okay, so that's a trick question. Okay, so
Okay.
so the guiding principle is I want a photograph. I
Right.
don't care if you use your iPhone to take that photograph.
Sure.
Okay, but I'm not a fan of intraoral cameras.
Okay.
They're better than nothing. So if you can tell me I'm not going to use a DSLR, I'm going to tell you an intraoral camera is fine.
Right.
Okay, but if you say to me I'll do whatever it takes, then I'm going to tell you to get a DSLR.
Right. No, and I've got my 70D and I've got my 100 millimeter lens and my macro flash, and I just need to
So that's
do.
why you're in debt. You buy all this fancy shit,
It was
man.
a graduation present, okay?
Yeah, I'm giving you a hard time.
But no, and I just need to do it and
But what's
use it.
holding you back?
I'm in the Army, and case acceptance is really easy because they don't have to pay for anything. And
Right,
my
and you got it. Then they have to do what you tell them to do. But here's what I would tell you in this situation. Okay.
right,
So at some point you want to leave the army.
I do.
Okay, and at some point you're going to get out, and my guess is you're not going to necessarily start up your own practice right away.
I'd like to, but I don't know if that's hopeful thinking.
Well, that's not. It's not even just hopeful thinking. It's probably logical that you probably should go and work and explore the area. It's like when you move to a new area, you should rent first before you buy. Correct.
Correct.
Okay, so when you get out of practice and you go somewhere, I think you should associate before you open or buy, because this way you can try it out. You can see what the patient base is like,
Right.
what the area is like. Do you want to be on the north end of town, south end of town? A lot of these things that you just don't necessarily know all the time. Okay, so what would make you more desirable to potential associateships if you had a log or a portfolio of cases that you've done?
No, absolutely, and be able to point to, this is what I've done, this is what I can do. Here we go, proof.
Right, exactly. So to me, that's what I would tell you. And see, here's the challenge that we face is, at the end of the day, private practice dentistry, okay, the solo practitioner, we're not hiring enough people. There's only so many that we're hiring, right?
Right.
So those jobs, if that's what you want, if you reach that stage where you don't need to make the absolute maximum dollar amount, but instead you need to be an apprentice and learn more than you necessarily need to make more, then you need to compete for those positions. And to me, for you to compete for those positions, then you have to come to me, or at least someone like me, and you have to show me why in the hell would I want you in my practice. And if you come in and if you're just like everybody else, you say I do good dentistry, because I've never seen anybody that says I do bad dentistry.
Right.
Okay. So then I would say, well, show me some examples of your root canals. And you
Okay.
can't tell me, well, I don't take pictures. I'm like, hell, you don't take x-rays?
Right.
Right? Okay, so, and then I would say, well, show me some examples of some anterior bonding that you've done. Because, I've interviewed people that come in as associates and say, well, I'm good at cosmetic work and I want to do some of that. And I'm like, great, let me see some of your work.
And they have nothing.
They have nothing. I'm saying that means so how the hell can you come to my practice and for me or my team members to suggest to my patients to see you?
So I would say here, right up there with case acceptance and leadership and communication, you'd put photography there, because that's actually part of communication, both to the patient and
it's case acceptance, it's leadership, it's communication. You don't have to talk when you put a picture up of a cracked tooth.
okay.
All you have to do is say, Mrs. Jones, you see that?
Right.
Yes. Great. What do you want to do about that, Mrs. Jones? What's
Well,
Mrs. Jones' answer going to be?
well, I want to fix it.
Great. Mrs. Jones, here's what it takes to fix it.
Okay. No, absolutely. Um, and this is perfect because this is what I need to hear, and therefore this is what I need to share with my audience and my friends and
But
what.
it's not, you see, what's the sad part? Listen, I don't mean to interrupt. Okay. I
No, this is
constantly
good.
interrupt. Okay. The sad part of it is, and this is not just for 0 to 5 years out of school.
This is
This is
everybody.
for 60. This is everybody.
Right.
I can't tell you how many people simply do not take pictures. Like, look, I have every piece of technology known to man. Okay. Every piece of it. And every interview I do, everything I write, the number one thing on my list is the least expensive technology I have, and that's a camera. And every one of people in your generation has a stupid camera in their pocket.
Right. And you can pull it out and take pictures of cases with it.
And I've used my iPhone before.
Right.
Because it takes an actually pretty damn good
It's
picture.
pretty good. It's
How about this?
amazing
It's so
at this
better
point.
it's so better than stick drawings.
Right. Well, and sometimes it's even better than a little intraoral wand.
It's always better because right then and there, you know what you can do with that picture you take with your iPhone? You can text it to your patient. You can email it to them. You can, you can print from it. There's so much you can do. You can like tap their phone and you can airdrop it to them. There's so much you can do with it, right? And so to me, case acceptance is number one about communication. It's about understanding your patient. But case acceptance to me is about the proof. And the proof is just showing them a picture of what you're seeing. Say, Mrs. Jones, you see what I see here? Yes, I do. How would you like to handle it? I don't know, Doc. You're the expert. Great. Mrs. Jones, this is what I would do if this were my tooth. We'll put together a plan. If it makes sense for you, we'll get it taken care of.
Perfect.
And see, to me, that's being authentic, right?
Right. And
It's not a sales pitch.
no
It's like,
pressure,
here's what you need.
no lines that feel recited.
Yeah.
No, absolutely.
Just no bullshit, right? It's straightforward. Listen, if you want to do this, great. And so to me, again, see, this is going to all build on each other, okay? So I can, okay, I'm not even saying at this stage of my life I've reached that point. I reached this point 10 years ago, okay? Because I went through that. I remember I said there's phases in your practice life, right?
Right.
There's money, time, and professional satisfaction, okay? So I focused on the money part for the first 3 or 4 years, okay? And then what that did is that took off the pressure of needing to hit home runs on the things I wanted to do.
Okay.
And then that took off the pressure for me having to sit there and look at a patient and hoping they say yes to me, because that's the difference between making money and making the payroll.
Right.
I can literally look at them and say, when you're ready, I'm ready.
Okay. No, that makes all the difference in the world. To have that ability to just present, give them the space, give them the opportunity, be authentic, and put it in their court.
Yeah, that's in a nutshell, that's what it is. Certainly there's lots of things that go with that.
A lot of nuance. No, absolutely. Well, I want to push back and go back to one thing we were talking about a little earlier, which was the how of expanding the scope of your practice.
The original question that I never answered.
Right. And let's take away the, I kind of gave you the loaded situation with a friend who is financially strapped and, stressed about taking too long on a procedure and learning it. Let's take that away and let's just say, okay, I have finances, I have the willingness, I have an opportunity to learn. What would be the best way to go about expanding the scope of my practice and learning a specific new procedure? And how do people do it wrong? Can you take too many CE courses? How do you evaluate CE courses? Like, do I take this one or this one? And how do you know, is this worth my time? Is this going to be what takes me to the next level? Or is this going to be just kind of the same old, what I've already hit on? Does that make sense?
No, absolutely makes sense. Okay. So I'm very opinionated, correct? So everything is just my opinion. Okay.
Right.
So I look at so the answer to your question is, can you take too much CE? No and yes. Okay. So the answer is yes if it's the wrong CE or the wrong person. The answer is no because, in my opinion, or at least in the Asian or Indian culture, we're grown up to believe that there's nothing above and beyond. There's nothing better than education.
Okay.
So that's first and foremost and culturally that's what's ingrained in me. Okay. For God's sakes, my grandfather used to lock me in the closet and tell me to read the
Read the
dictionary.
dictionary. Yeah, that was pretty
so,
amazing.
so, so education is unbelievably important. Okay. So let me give you my take on education, and this is a roundabout way of answering the question. Okay.
Okay.
So ultimately, there's nothing new under the sun. And as an educator myself, I will tell you there's very little that I'm telling you that somebody else can't tell you.
Okay.
Okay. But the difference is that you will respond and connect with various educators better.
Hmm.
Okay. So you will have a tendency to learn best from someone you somehow connect with. Now,
Okay.
that could be because they are meek, that could be because they're opinionated, that could be because they're aggressive and challenge you, or that could be for any, they're brown. You might just like to learn from brown
Of
people, okay?
course. Why wouldn't
So
you?
it could be any of those number of things, right?
Right.
So now I look at education as three steps, okay? There are, economically, it works out this way as well, okay? So to me, if I were the person that's finally, settled financially and I want to learn something new, I would go to a bigger meeting, okay? They're the least expensive meetings to go to, and I would try to hear as many different speakers on that area of topic that I'm interested in, and I would find somebody that I connect with.
That you resonate with. Okay.
Exactly, okay? And then I would go and learn scientifically some of the basics that I need to learn. And the good news on all the science stuff that you need to learn today, what
Hmm.
I call the boring stuff, all that shit's on the Google and the YouTube.
Right.
Okay, and or it's online. Okay, through online memberships of some sort. Okay,
Or even textbooks if you're really old school.
right. No, absolutely. I learned the majority of my implant stuff through textbooks.
Right. You just go read
Okay.
Mish.
Yeah, exactly. I read both his books. They're in my bathroom, so that's my reading area, right?
Perfect.
And so that's the second step. Okay. Then to me, the third step is then I want to go back and learn from that person I resonated with in step one at the big meeting,
Okay.
and then I will go to his or her workshops, his or her classes. If they're not a dedicated educator in that sense, then I will say, can you mentor me? Can I come to you? Can I like do your dishes? Can I watch your
Right.
car?
Right.
Whatever it is for me to learn from you, correct? And to me, that's why I say you can take too much CE or the wrong CE, because it may not be the wrong CE in a sense, but it's the wrong deliverer, the wrong message deliverer.
And so this mentorship, what what would be the best way to go about like trying to find a mentor? Like is that something that is cliche? Like what does that even mean? Are you just watching them and figuring out how and why they do the things they do, or are you bringing them cases and you're saying what do I need to do, or like what's how would that relationship work for someone who feels like, oh, what how do I get a mentor?
Great, that's a good question. So here's what I would tell you. Generally speaking, okay, your legacy is all about what you give other people.
Okay.
Okay, so ultimately, I want to make a mark in life. Okay,
Right.
so for me, how I measure my own success is how I make other people successful.
Hmm.
Okay, so I'm dying to mentor somebody.
Okay.
Okay, but mentoring is all about you finding that person, having the guts to ask them,
Right.
and then looking at their situation and saying, how can I make it as easy as possible for them?
Okay. So
Okay, and then that may be web interviews for some people. That may be bring the cases over to my office for some people. That may be bring your patient to my office for some people. That may be, hey, I'll come to your office with your patients. That may be, hey, I'm going to this CE this weekend. You're welcome to come hang out with me this weekend.
right.
Okay. So ultimately, you've got to, again, it's got to be, you just got to ask somebody. Like if somebody came to me and said, hey, I want to learn from you, how can I learn from you? I said, dude, you just got to follow me around.
Right.
If they said, hey, can I come see you after work? No.
Right.
Okay. Can I see you at lunchtime? No. Hey,
Just
can you
follow me
come to
around
my
at my
office and help me
practice.
with the case?
No.
No. I mean, if you want to learn from me and me mentor you, just come to the office. I'm there from 8 to 5.
Right. And I think there's two parts that people miss. One is they miss boldness or the courage to just step out and ask someone.
What's the worst thing that'll happen?
They'll say no, no big
It's like
deal.
asking girls. I mean, I had to ask like 800 people before I found a sucker that would marry me. Okay.
Yeah, persistence pays off. No, I read a book in dental school called Never Eat Alone. And it's basically about this concept of building relationships and reaching out to people, not in like a cheesy, I'm networking, here's my business card, but just in a making connections, talking with people sort of way. And it changed the career of my dental school, or the trajectory of my dental school, because then I was like, okay, well, I'm in the Phoenix Valley. I want to go meet Gary Takis because he was the only one with a podcast at that time. And I went to his practice. I want to go meet Howard Ferran. I went to his practice, ended up working for Howard Ferran. I want to go meet Leanne Brady. She was just down the road from our dental school. And so over the course of dental school, I feel like I developed a lot of relationships that I wouldn't have otherwise developed if I hadn't have just asked and gone out and put myself out there. And people, even people that are quote unquote big names in dentistry, are just people.
They listen. The people that are big names, they became big names by helping and being helpful.
Right.
Okay, but the difference I'm just telling you from personal experience, is you have to make it easy for them.
Right. So
Like
that's the second part.
I get emails every week. Hey, can I take you out for coffee, dude? I can afford my own coffee. I don't need coffee.
Right.
Can I take you out for lunch, dude? I don't even know when I'm going to get lunch.
Right. Can I bring you lunch at your office and then follow you around? Would you take them up on that?
Sure.
Yeah. Okay. See, making it easy. So it's that willingness to ask, and then to realize that usually these people are maxed out in terms of their time and attention. And
yeah.
And so to ask them to on the side mentor you. And even as an associate, I think sometimes associates come into a practice thinking, oh, this person does implants, they do these procedures, and there's kind of this expectation of mentorship. But that means that one of you is not going to be producing during that mentorship time, and it's not going to be the owner doc who's not producing. It's going to be you as an associate who's going in there and watching them and asking them questions and seeing how they do things. But if you don't realize that beforehand, you're going to be thinking, oh, well, I see my patients and he sees his patients. When are we going to do this mentorship thing? And I think people can set themselves up with false expectations of like how that works.
No, and that's the exact struggle I have right now with my associate partner in my practice. It's he's been there 9 months and he's learned a lot. Okay, but I was just talking to him today saying, you haven't maximized what you can learn from me. And he looks at me like, you're always busy. I'm like, yeah, but you're never prepared.
Right.
Okay. And he goes, what do you mean by that? I go, you just don't have it ready on at any given moment. Right. And so today, just randomly, he had his CEREC machine in our office and he pulled up a case and he says, hey, I want to show you this. And we went into this whole thing and we got like 5 or 6 great points across. And I said, this is how you get mentored.
Right.
You just have the crap ready randomly.
And then when you've got a free moment, you're like, hey, take a look at this.
And you ask me one question and it leads to 5 other things.
Right. And that kind of organic relationship and making it easy for you is not something that happens naturally for most people. So I think we, and when I say we, I mean my generation and associates and new dentists, need to realize that making it easy, being ready, taking advantage of every opportunity. And if a patient cancels on my side and I have a minute to go, you're doing an implant, instead of hopping on Facebook or hopping on Dental Town, which, that still would be great, but go watch you do that procedure. Go assist, go do whatever you can.
But I would say it's much more than that.
Okay.
Okay. Because so number one, let's say your patient doesn't show up. Okay. And now you're stuck in your office doing Facebook or Dental Town or porn or whatever it is that you're doing. Okay. Okay. So that means your team members are not seeing you being eager.
Okay.
Your team members aren't seeing you learning. Okay. You're not interacting with the team members and developing a relationship. You're not able to introduce yourself to other patients hey, maybe I'm doing the hygiene checks on this column today, and those are patients that you should get to know.
Okay.
Right. So if you get stuck in your office, that just means you're not interacting with human beings.
Right.
Okay, and it's that interaction. It's just that being seen. It's that being available, being in that moment, being in the right place at the right time doesn't happen by sitting in front of a computer or by hiding in the back in the break room.
Right.
Okay, being in the right place in the right time. You just walk around the office in circles.
Right.
Something good is bound to happen to you. Somebody's going to ask you a question and say, "Hey, can you do this?" Oh, I didn't know you did root canals.
Right.
We've just been giving them all to Dr. Senior.
Okay. Yeah.
Right. And so to me, you've got to make yourself available. Okay. And you never know that person at the front, the gatekeeper of the practice, may suddenly have a conversation with you and say, you know what, this dude isn't that bad.
Maybe I'll start putting the good patients on your schedule too.
Yes. And then and I think more people are like me than they realize is that I give you as much as I see you taking.
Right.
Okay. So if I see you like my guy doesn't my associate partner doesn't work Mondays. Okay.
Okay.
So he's Tuesday through Friday at my office. So I always ask him, what do you do Mondays? He goes, blah, blah, blah. And I go, dude, you should come to the office. He goes, why? I said, because when I see you here, I'll give you other stuff to do.
Right.
I'll funnel you more patients because I see you putting the effort forth to
No.
earn that. I see the eagerness and the desire that you want to be great. That's because you're here on your own dime.
And I think that desire to learn has to come from somewhere. And going back to what you were saying earlier, those three things, it's either money, professional satisfaction, or time. And they're actually giving up time. So they have to either really want to learn for their professional satisfaction or, and even the money side of things, it's kind of a long play to be saying, I'm going to go in just because I want to learn the business systems or I want to learn this other procedure or I just want to be there. I want to be a team player. Um, it takes a lot of desire to overcome our natural laziness. So to hear you say that from an owner's perspective of what an associate could get out of the opportunity that they're given if they are willing to go that extra mile makes a huge difference.
Well, I would say that 90% of associate relationships have failed. Okay, not because they end poorly or badly. They don't achieve, the associate doesn't achieve what they needed to achieve in that. Okay, so because at the end of the day, as a business owner, it's no different than as an associate. You have to there are times where you work in your practice, and then there's times where you work on your practice. So
Right.
just because you are an associate and you don't own the practice doesn't mean that you shouldn't be working on your practice. Okay, and that means you should be going through your day sheets. You should be looking up your cases. You should see, what cases do you have I call it a book of business. In other words, do you have an index card? So early in my career, I used to carry around an index card in my pocket. And
Okay.
I would write the patients that I diagnosed in hygiene, and I would have a stack of index cards, and then every Friday I would come into the office and I would look up those patients. And I
Hmm.
would see where are they at? Are they scheduled? Are they not scheduled? And I would remember that patient, okay, from that week. And I could go to my team and say, hey, what happened to Mrs. Pat? I thought she seemed really ready to go. Why didn't she schedule?
Right.
Okay, so because ultimately, and you can call this age, but I'm not that old. I'm only 40 years old, for God's sakes. Okay, so I would say to you that most associateship, in my eyes, don't work because the associates think that shit's handed to them, and they don't take ownership of their own destiny. So to me, you're in control of your own destiny. So if you want to do more cases, if you want to be more productive, then do the things that it takes to be more productive. Just
Right.
because you're an associate doesn't mean that it should always be fed to you. I'll tell you where it's fed to you, and that's in group practice environments. But what's fed to you are fillings and fillings.
Right.
I mean, it's not anything that makes you grow.
So would you say are you I know you structure your associate compensation, I think you said in one of Alan's podcasts, as a 3-month running average of I don't know if it's running average or per quarter or how you do it, but of the last 3 months so that they kind of have and I think that was collections and so that they have kind of a stability factor of they kind of know what's coming and it's not varying as much as their production goes up and down. Would you be a fan of getting rid of the minimum, like the 500 or whatever $600 per day minimum that associates have? Do you think that would motivate people more, or do you think that's a necessary safety net for the practice to be motivated to put patients on their books?
I would say I would say that would be dependent on what fits in the associate's life.
Okay.
Okay, so at the end of the day, I have a good associate partner right now. I love him. I
Right.
like him. I want him to be a long term. I shouldn't say I love him. Not in that way. Okay, I enjoy him. He's a good mental fit for our practice.
Right.
Okay, so I want to find out what makes him happy, and if makes him happy to have a minimum, then I'll be happy to have a minimum. Because at the end of the day, if you're not hitting a minimum, it's not a good relationship.
Right. No,
Okay,
absolutely.
he or she's not winning, and I'm not winning. Okay, so I'm totally okay with minimums. The other, again, and this is not beneficial to me financially, but the other reason I like minimums is that it makes me have skin in the game.
Okay.
Okay, so I want you to at least produce. I'm paying you this much anyway. I might as well get the work out of you.
Right.
Okay, so I have a tendency to give you more stuff or feed you more stuff or bring you in to introduce you to patients because I don't give my associate anything. I introduce him to patients, and then patients can choose to see him or not. And I
Hmm.
give him authority. I tell the patients, hey, I want you to meet Dr. K. He's fantastic. He honestly, this is not necessarily true. I say he's better than root canals than me. Okay. He
Right.
enjoys them more than I do.
Okay.
Okay. And I'll say, you know what? I'd love for you to meet him. And then if that works for you, I'll love for you guys can schedule together.
Right.
Okay. And then it's on him to go in there, not screw it up.
Okay. No, and that seems like a healthy way to do that. And versus just things show up on my schedule out of the blue, I think people tend to be one step removed from this whole process of
Or you may not even agree with it.
right.
Like I don't like seeing his patients on my schedule to a certain degree because he wants to do crowns on teeth I want to do onlays on, or he wants to do fillings on teeth I want to do crowns on,
Right.
and stuff like that. And that's the individual clinician autonomy that we so greatly desire.
Right.
So I don't want to do that, but at the end of the day, I tell my team members, listen, if he diagnoses it, then that patient needs to see him. If I diagnose it, that patient needs to see me unless I introduce the concept of him to the patient.
No, absolutely. Do you have energy to shift and move to a different topic here?
Dude, I'm good. I got no kids, no wife in the house. I'll go all
Perfect.
night. I don't care.
And that we did. We have another hour of interview with T-Bone that we're going to bring to you next week. Hope you enjoyed that and talk to you next time on the Shared Practices podcast.